Question 291. Which statement best describes electrolytes in intracellular and extracellular fluid? A. There is a greater concentration of sodium in extracellular fluid and potassium in intracellular fluid. B. There is an equal concentration of sodium and potassium in extracellular fluid. C. There is a greater concentration of potassium in extracellular fluid and sodium in intracellular fluid. D. There is an equal concentration of sodium and potassium between intracellular and extracellular fluid. Answer A. Explanation. There is a greater concentration of sodium in extracellular fluid and potassium in intracellular fluid. Physiological adaptation. Question 292. The sexually transmitted disease, sometimes referred to as the silent STD, that is more common than gonorrhea and a leading cause of PID is A. Genital herpes, B. Trichomoniasis, C. Syphilis, D. Chlamydia. Answer D. Explanation. Chlamydia is a sexually transmitted genital infection and is manifested in males primarily as urethritis and in females as mucopurulence cervicitis. Clinical manifestations of urethritis are often difficult to distinguish from gonorrhea and include mucopurulent discharges from scant or moderate quantity, urethral itching, and burning on urination. Possible complications or sequelae of male urethral infections include epididymitis, infertility, and Reiter syndrome. In homosexual men, receptive and erectile intercourse might result in chlamydia bronchitis. In women, the clinical manifestations might be similar to those of gonorrhea and frequently present as a mucopurulent endocervical discharge with edema, erythema, and easily induced endocervical bleeding caused by inflammation of the endocervical columnar epithelium. However, up to 70% of sexually active women with chlamydia infections are asymptomatic. Complications and sequelae include salpingitis with subsequent risks of infertility, ectopic pregnancy, or chronic pelvic pain. Asymptomatic chronic infections of the endometrium and fallopian tubes might lead to the same outcome: physiological adaptation. Question 293. When a client who is having trouble conceiving says to the nurse, "I've started taking ginseng," the best response by the nurse is A. No studies show that ginseng is effective for infertility. B. Some studies show that ginseng enhances in vitro sperm motility. C. Why don't you try acupuncture instead? Many studies have shown it to be effective for infertility. D. It's possibly not going to hurt you, but it's also probably not going to help. Let's look at some other alternatives. Answer B. Explanation. Some studies have shown that ginseng and astragalus have enhanced in vitro sperm motility. Ginseng has long been used in traditional Chinese medicine to enhance male fertility, so choice 2 is correct and directly addresses the client's comments. Many times, couples struggling with infertility turn to alternative therapies in desperation. They can be very expensive and some are harmful. Ginseng should not interfere with any of the traditional fertility treatments and might help the couple feel empowered that they are also doing something on their own. Choice 1 is not true. Choice 3 introduces another alternative therapy. It is true that acupuncture is a traditional Chinese medical therapy and has been shown in several clinical studies to be effective in treating infertility in both women and men. The best response by the nurse should address the therapy the client states she is using. Choice 4 dismisses the client's attempts to work through her issues and contribute to the solution. One concern is always that more traditional therapies might be ignored and time might be lost to alternative therapies. But this response causes the client to perceive the nurse as unsupportive and inhibits further discussion and disclosure, health promotion, and maintenance. Question 294. Which of the following procedures describes an opening between the colon and abdominal wall? A. Ileostomy. B. Jejunostomy. C. Colostomy. D. Schistostomy. Answer C. Explanation. The colostomy is an opening between the colon and abdominal wall. The remaining terms describe the other types of ostomies. Physiological adaptation. Question 295. The method of splinting is always dictated by A. Location of the injury and whether it is open or closed. B. The severity of the client's condition and the priority decision. C. The number of available rescuers and the type of splints. D. All of the above. Answer B. Explanation. The method of splinting is always dictated by the severity of the client's condition and the priority decision. Basic and comfort. Question 296. The nurse is transferring a client from a wheelchair to the bed. Which is the correct procedure? A. Pull the client toward you and pivot him on the unaffected line. B. Pull the client toward you and pivot him on the affected line. C. Push the client toward the bed and pivot him on the affected line. D. Stand the client on both legs and push him toward the bed. Answer A. Explanation. Pulling the client toward the nurse lowers the workload force. Pivoting on the unaffected line offers strength to support the affected line while pivoting to the bed. Basic and comfort. Question 297. When the nurse is determining the appropriate size of a nasopharyngeal airway to insert, which body part should be measured on the client? A. Corner of the mouth to tragus of the ear. B. Corner of the eye to top of the ear. C. Tip of the chin to the sternum. D. Tip of the nose to the earlobe. Answer D. Explanation. A nasopharyngeal airway is measured from the tip of the nose to the earlobe, reduction of risk potential. Question 298. Melissa Smith came to the emergency department in the last week before her estimated date of confinement complaining of headaches, blurred vision, and vomiting. Suspecting PIH, the nurse should best respond to Melissa's complaints with which of the following statements? A. The physician will probably want to admit you to further observation. B. The physician will probably order bed rest at home. C. These are really dangerous signs. D. The physician will probably prescribe some medicine for you. Answer B. Explanation. Pregnancy-induced hypertension (PIH) is a hypertensive disorder of pregnancy developing after 20 weeks gestation. It is characterized by edema, hypertension, and proteinuria, preeclampsia, and eclampsia. The cause is unknown. The client with advanced PIH needs rest, and home is the best place to get it. Hospitalization is not necessary in this situation. Medication is not indicated. Physiological adaptation. Question 299. Which of the following client groups should the nurse recognize as the fastest growing segment of the homeless population? A. Single adult men. B. Single mothers with 2 or 3 children. C. Runaway adolescents. D. Single adult women. Answer B. Explanation. Single mothers with 2 or 3 children are the fastest growing segment of the homeless population. The majority of the children are under the age of 5, and the total number of children who are homeless account for more than one-third of the homeless population in the United States. In the past, single dads were the largest group in the homeless population, with more men than women being homeless. Runaway adolescents account for another group of homeless children. Many are victims of abuse or long-term family or school problems, health promotion and maintenance. Question 200. In managing nausea related to morphine epidural anesthesia, the nurse should administer A. Indocin, B. Codeine, C. Motrin, D. Compazine. Answer D. Explanation. Compazine is the drug that should be administered. Basic and Comfort Topic 4, question set D.
Thank you for watching.